Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine in Pennsylvania for our members and their patients. Thanks for tuning in.
Hello, and welcome to the latest episode of the POMA Does podcast series, sponsored by the Pennsylvania Osteopathic Medical Association. I'm Bailey Reale, and I'm a second-year medical student at the Lake Erie College of Osteopathic Medicine. Today, we are going to explore the topic of suicide in physicians. I'm privileged to be joined by Dr. Chadd Kraus and Dr. Elizabeth Ramsey. I'd like to start by asking you each to briefly share your reason to participate in this episode.
Go ahead, Dr. Ramsey.
Okay, I get to go first. I'm a practicing general psychiatrist in Northwest Pennsylvania in Meadville. As someone who has treated physicians as patients, I find this topic extremely important, especially because physicians who are getting mental health treatment successfully can practice medicine. And it's important to keep practicing osteopathic physicians in the profession, especially when mental health issues treated successfully and treatment works. And there should never be a reason why we can't do this.
So thanks for having me. My name is Chadd Kraus. I'm a practicing emergency physician and residency faculty member at Geisinger Medical Center in Danville, Pennsylvania. I am also the current president of the Pennsylvania College of Emergency Physicians and the director of research for the American Board of Emergency Medicine. And this topic is really, really important. We all have heard the phrase, physician, heal thyself. And there's been tremendous stigma associated with mental health and behavioral health, both among the general public and particularly among physicians. And really during COVID particularly, this has always been an issue, but particularly during COVID, we realized more than ever that it was okay to say you weren't okay. And we all heard of tragic deaths and deaths by suicide by physicians. We know all the tragic statistics of a medical school class or more each year of physicians who die by suicide. So this is a really critical issue, and an issue as an emergency physician particularly. We all heard the story of Lorna Breen, who spent some of her childhood actually here in Pennsylvania, in central Pennsylvania. And, you know, her memory and legacy will always be that it really brought to light the importance of having physicians in every specialty, again, be willing and able, without stigma, without recourse, to be able to say it's okay to not be okay, and to say that and to seek the help you need. So those are the reasons I'm really interested in this topic.
Thank you so much both for your introductions and for being here. So my interest in this topic is multifaceted, and the most obvious reason I'm passionate about preventing physician suicide is because myself and many people that I care about are at various stages of their training to become physicians, or already are, in their career as physicians. But the largest reason for my passion is the loss of my father to suicide in 2016. And I've had a career in public health before returning to school to become a physician. And I think that we can all recognize that there are sort of various systemic factors that contribute to physician suicide. And I do want to talk about that. But the first question I would like to pose to you both, given your experience and expertise is as practicing physicians, is just to talk about the culture of medicine. And so understanding that there's no all-encompassing answer, what aspects of the culture of medicine do you think most contribute to the factors underlying physician suicide?
I'll defer to Dr. Kraus first.
I think there are many factors, and some of the things that we prepare ourselves for as physicians, we need to do. So some of the sleep deprivation we go through, the stresses we go through, all of those are things that we do to become physicians that are probably inevitable in our training. What isn't inevitable and what we really allowed to become normal and shouldn't be normal is, again, not taking care of ourselves, whether that's physically, whether that's emotionally, whether that's spiritually. And especially as osteopathic physicians, we think about the care of the whole person. And we as physicians are probably the worst patients in caring for the whole person of ourselves. And so I think that the things of our training that are necessary and that will probably always be part of not only our training, but the way we view helping others and putting others' needs before ours are probably at times a double-edged sword or a two-sided coin that really sometimes causes us to not consider our own needs, and that we really do need to be at our best and take care of ourselves as well as possible in order to take the best care of our patients and our communities.
I agree with all of that. And sort of, I think med school selects people who are perfectionistic and may be more rigid because that's the only way to achieve that level of success in schooling. And so you have people who are used to making straight A's, not used to making mistakes in training. And then the training system itself perpetuates everything you do must be perfect. You must always have the right answer. And you must have the right answer immediately, right off the top of your head. And in reality, that's unrealistic. No other system expects that except for the healthcare system. And then I think this is the importance of good mentoring and good attendings. And something that they really need to be mindful of is that we should not expect this unrealistic standard from all of our trainees. We should be relaying knowledge and then asking for knowledge. And if there's some sort of deficiency or issue, being able to address that in a way that helps the person improve and not necessarily brings them down. Because you can see how those continued insults to someone who's used to being perfect would definitely hurt and cause questions about whether or not this is right for me. And I don't think I'm ever going to make it. And that negative self-talk doesn't lead down a good road. And we've seen this a lot. And so then all throughout training, there's not really that discussion on self-care. There's not an emphasis on what you need to do to help yourself. If we think about like work hour restrictions, in my training, I think it was 30 hours. Again, in no other profession do you expect someone to work 30 hours continuously with no rest and then be perfect on top of that. It's set up to fail. And then with no other support within your organization, it's a recipe for disaster. So I think like Dr. Kraus said, it's exactly right. Like sleep deprivation, we know what those consequences are, and yet that's what we require of our students and residents and even attendings in some ways. And so I think adjusting that during training, working on the self-care, taking time out, not expecting perfection in the moment. And those are all things that can be changed to reduce the self-doubt.
Thank you both. I think you brought up some very resonant points. I think about the culture and how we can have more of an impact as individuals on culture sometimes than we can on systemic factors. So as individuals, how can we help to shift beyond just encouraging the self-care? What can we do? I suppose if you are an attending, you can be the attending that you described, Dr. Ramsey, to mentor your students and to provide them better opportunities. But can we take that one step further? How can we make small shifts or small changes in our day-to-day lives to sort of help start the shift?
So I think, again, with training, so I'm fortunate that, we have medical students on our rotation, and part of the rotation is discussing these exact things. What do you do that you like to do that's outside of work and that's totally unrelated to work? And so encouraging students to take time for that and to build that. And then that student in turn will encourage another student. Also, being able to, as much as I don't like saying it like this, but to provide lectures for students and residents on how to do these things, like what are your hobbies? What are your interests? Think about what drives you outside of this career, because you go to work and then you go home and then you work more. We really do need a break from this. And that's how I've been able to maintain this career and not be feeling totally dragged down at the end of the day, is that when I come home, I have something to look forward to. Now, granted, it's more work, but I chose to have my farm. I chose to do this work. And so for me, it's fun, it's exciting. And so always having that is important. And then I think that will carry over to your colleagues and encouraging your colleagues to do these things, and then spending time with your colleagues outside of work. Our hospital just had a physician awards night. And so there was a lot of people that I don't ever really get to see and I haven't seen in person, because all of our meetings have become virtual, but talking about what they're doing, and what's going on in their lives outside of work. And so I think that's how we can change the system, is just in our communication and interactions, starting with the student level, especially.
Sounds like leading by example in a sense.
Absolutely.
Meaningful
Yes.
change.
And I would build on what Dr. Ramsey just mentioned in two ways. One being the importance of being there for your colleagues. It's very, very difficult to explain, even to a family member, a friend, what a career and a life in medicine is like, and really what it is to go through all of this. Unless you've done it, it's very hard to explain and capture what it really is. And so being there for your colleagues and having colleagues who are there for you. So we talk about mentoring, by more senior members of your team or your group, but really peer-to-peer work and support is really critical, I think, because when you're the one that needs that shoulder to cry on, literally or figuratively, or that hand up, and then there's a point at which you are the one providing those things to your colleagues is really important. And then I think that we shouldn't underestimate the power that we have and the voice we have as physicians in advocacy for more systemic changes. So I think that, Lorna Breen's story is particularly noteworthy, that her family and many colleagues really pushed to the highest levels of government, all the way to the US Congress and to the president's desk, having laws, having public interest and public recognition and acknowledgement of these issues that physicians go through, and really codifying it. And sometimes that's what it takes, is that sort of attention and that sort of public recognition, and even sometimes laws and regulations that require certain things that are forcing functions, that you can't have questions in licensing, for example, or questions in hospital privileges that stigmatize mental health or stigmatize people who are seeking treatment for their mental health, just as we wouldn't stigmatize if you sought treatment for your diabetes, your hypertension, or any other physical or non-physical ailment that we might have. And so I think efforts and advocacy particularly, we shouldn't underestimate, because we really, as physicians, have a great voice to be heard and make changes on that larger level as well.
Those are great points. Thanks, Dr. Kraus. I think that it is important to recognize that inherent in being someone that takes care of others in this role is a platform that you can use to try and advocate for more than just the individual in front of you. So that is a great segue into sort of my next question is, what are some of the main interventions that you're aware of that are happening in Pennsylvania to help prevent suicide in physicians?
That's a good question. I'm not entirely sure that I know, but one of the things that I've done through COVID is back off watching the news and news media just for my own sanity. I know I've been asked recently to serve with the Physicians Health Program, to complete evaluations, and that's pretty narrow in scope. I think that through podcasts like this and just general outreach is trying to be more active and open and having these discussions, because that's the first step. People have to be willing to talk about things that are hard to talk about. And for me, I do this every day. So for me, it's fairly easy, but I can understand somebody else with the stigma associated with mental health treatment, especially in physicians, wouldn't be so comfortable talking about it. But again, for especially practicing psychiatrists, this is what we do. And we're always willing to listen. I like to think it's one of our strengths. But I think that hopefully that with POMA and PA Med, putting this information out there and making people aware, that's one of the first steps. I don't know if there's any legislation in terms of work hour restrictions, or if medical schools are changing the restrictions for students, but I'm a little bit more separated from that than perhaps Dr. Kraus would be.
So I'm not aware, Bailey, of any specific legislation or regulatory efforts, but one thing we've done as emergency physicians in the Commonwealth is really to bring awareness of these issues to the medical boards, so the state osteopathic, the state medical board, and really to start to think about, are there ways to address this in hospital credentialing? So again, when a hospital asks you medical staff questions about your fitness for duty, so to speak, to ensure that those questionnaires and those processes don't stigmatize mental health or mental health treatment seeking. Probably more importantly, the second, that you're not stigmatized and you're not punished in either a licensing process or in a credentialing process, that you should have fear that that's going to dissuade you from seeking treatment because you're so concerned that if I put on a licensing application or on a hospital privileging form that I have mental illness or I'm seeking care, that somehow puts a black mark on me or stigmatizes me further. So again, most of those efforts have really been informal. I think there's various efforts at medical schools to address this more from again, recognizing and talking to students about it. I think it's probably under a larger umbrella of wellness or resiliency, but I think medical schools probably and residency programs probably are doing a better job all the time at moving us in the right direction. We probably have a lot of opportunity and a way to go, but I think we at least recognize it more than maybe we once did.
Thank you. I think that is a really important point, because we know that, as Dr. Ramsey has mentioned, and you have as well, that the stigma is a huge factor in leading people to not get the help that they need when they need it, regardless of sort of what caused the issue, whether it started in their training or predates their training or wherever. Now, if either of you have any ideas in terms of something that you wish we were doing or something that we could do better systemically beyond sort of getting the word out and being able to speak more freely about this and sort of the informal efforts to destigmatize in terms of your, readiness to work, questionnaires and whatnot?
So I think that culturally, the United States is shifting to be less stigmatized in terms of mental health treatment. People are being more open about having the discussions. And I think people are realizing that physicians are humans and physicians second. So I think that mentality is getting there instead of, the physician is the all-knowing, nothing's wrong with them. I mean, that's just not realistic if we talk about the numbers of physicians and the rates of mental health issues. And I mean, the whole time, I can't help but think how many physicians have marital problems and seek marital counseling. That shouldn't ever go against anyone. I mean, therapy in general, and therapy is one of the most effective treatments for multiple mental health conditions. And so certainly I think in someone providing care, we should be able to talk to somebody, a professional, and learn how to manage ourselves so we can better manage our interactions with others. And I've often joked and how we really need to start teaching certain therapy skills in elementary school, because it seems like the entire country needs to improve on things like distress tolerance and emotional regulation. Tempers have flared over the last few years for a lot of different reasons, and they continue to do so. So how do we work on that other than the individual level? And I keep drawing a blank there. How do we get everybody to do something all at the same time? How do we get people to just be okay with this and knowing when you treat your diabetes, you feel better, you can work better. It's the same thing with mental health. You treat your mental health, you feel better, you work better. And so I guess I just wouldn't expect anybody to say, oh, because this person is getting treatment, we can't credential them. But I guess I'm just being naive. But treatment works and it's effective, and we know that. I would just assume everybody would be all right with that. I'm just trying to work through this and I'm getting nowhere.
No, you're great. I know it's a big question and there's no right answer. There's no, one quick fix, which is part of the problem, but just, brainstorming places to start, I think is important too. Dr. Kraus, do you have any thoughts?
So there's a really great quote that everyone has heard that, life's not about waiting for the storm to pass, but about learning to dance in the rain, which I think is a great quote to sum up. We throw around words like wellness and resiliency very frequently to the point maybe of cheapening their meaning, especially among physicians. And I think what we really need to do a better job of, and it's not education necessarily, but it's equipping physicians across the spectrum of their careers, not just medical students and residents, but even physicians who are experienced and senior, about, what skills you really need to weather those storms. And not just, as Dr. Ramsey mentioned, the fact that medicine attracts a certain type of person and a certain type of personality. And so when that personality meets the stressors that are inevitable in our worlds and our work, how we manage those two things, not just in the face of underlying or chronic behavioral or mental health issues, but among acute ones, among situations when there's malpractice, when there's a bad clinical outcome for a patient, when other things in a person's life are challenging, and all those acute stressors that people have when the critical care physician is watching people die right and left during COVID in the ICU, et cetera. And I don't know that there's an answer or a cookbook for doing that, but I think how we equip people with the tools to manage those, and I guess, again, to learn to dance in the rain rather than waiting for the storm to pass, because a career in medicine is wonderful and fulfilling and satisfying, probably more so than any other career, but it probably has a lot more thunderstorms than most other careers as well, even on a daily basis, where you're seeing people who are having sometimes the worst day of their lives. And you're seeing that every day in and out. And at some point, you have to give yourself a chance to breathe and relax and digest all of that as well. And we don't do a very good job of that. Again, we sort of say, I'm perfect, I made the right decisions, and now I move on to the next patient, the next task in my professional day where I have to be perfect and get it right again and again and again. So I think teaching those skills as individuals, learning those skills and equipping ourselves is really important.
Well, thank you for sharing that. I think that is a great quote. And certainly from my experience, both in my training to this point and being surrounded by physicians for many years of my life, in one form or another, there are a lot of storms. So learning the ways to sort of fill your cup first so that you can continue to give to others are really important. And I think that you both have given some good examples of how to do that in terms of finding something that's fulfilling to you outside of medicine and making sure you protect that, and sort of, not to get too corny, but protect your peace, and finding ways to support your peers and, mentor others or be mentored yourself, and allowing those sorts of relationships to help build you up and support yourselves and others. Sounds like it could be really key to kind of, I'm not going to go so far as to fix the issue, but to make a difference, to chip away at sort of the root causes of the struggle that leads to suicide in physicians at a higher rate. Is there anything else, thinking about this topic in general and sort of the reason that we're here, anything else in terms of your own sort of wisdom or thoughts about the topic, or a piece of it that you're passionate about that you would want to share with the listeners that you haven't had a chance to yet?
Yes, Dr. Kraus just got my wheels turning with his last statements. I think one of the things that psychiatry does well in terms of medical specialties is supervision. All throughout my residency, I had an assigned supervisor, which I could discuss cases with, and that continued throughout the year. And that was in addition to the attendings that I was assigned to on service. So that was part of our training, was that separate time that I got to meet with that person to talk about patients, life, whatever. And that person changed throughout my training, but that person was encouraging and supportive and listened. And, and this was over a meal outside of the hospital setting. And I think that knowing that that was something that was always available to me was super helpful. And that person was like family, we talked about everything. Nothing was off limits. And so then continuing that into becoming an attending, that transition can be very difficult, especially if you don't know anybody or move into a new city. But knowing that, like, my other colleagues who were there would listen. I could talk to them. If I had a question about a case, or if I wasn't sure what direction to go in next, I could always talk to that person. Fortunately, I really like my colleagues, and it makes all the difference. And I know that no matter, what kind of day I'm having, they're going to be there. They're going to listen. And again, even now, we still spend time together outside of work. And if something's going on, they're going to have my back no matter what. And I think that security is one of the reasons why I love working where I am, because I have people surrounding me who want me to do a good job and are going to help me do that at work and at home too. And so if you can find one or two people that are always going to support you and help bring you up, and who can run cases by you, I think that is extremely helpful, because the isolation is a red flag. And so you never want to find yourself alone on an island. There's always going to be somebody. You just have to find who that person is, and then just keep their number, memorize it, and always reach out to them. And if it's the kind of person that, I aim to be, is somebody that's going to help bring you up no matter what. So that would be one of my recommendations.
I would echo that. I think, we talk about how there used to be physician lounges in every hospital, which are few and far between now, but the concept of those wasn't just about a cup of coffee or a bagel. It was really to have a physical space where colleagues bumped into one another and got together. And I think that going forward, that would be something I would really encourage, particularly residents and students, but again, physicians across the spectrum, is for us to recreate that lounge, whether it's, not in a physical space per se, but to recreate that kind of collegiality, that supportiveness, that, mentoring and sponsorship, not just in a professional way for promotion or the next job or leadership positions, but really that daily being there for the other person and the other person being there for you, is really the big value of organized medicine, and organizations like POMA and others that bring physicians together, I think is really, really key. Again, when the storm comes, as it does for everyone.
Thank you both. Yeah, it sounds like one of the biggest things that we can do is sort of lean into our communities and create our communities to help kind of keep us from being isolated and allow ourselves to share the burdens that kind of come along with this role. Because while the blessings of being a physician are many, there are also a lot of heavy burdens that come along with it that I've yet to learn about. So I guess my main takeaway from this conversation in general is that it's very important to find a way. Sometimes it feels more impossible than others to take care of yourself and to ensure that you are building time and space for the things that are important to you and advocating for yourself, but also utilizing your community and being a community member for others so that you can sort of be the support system for someone who needs it, and they can do that, for you as well. Anything else either of you would like to add?
I think remembering to be authentic is so important too. Acknowledging emotions that you're having, even if they're good or bad, just that process will help reduce anxiety. And then sharing that with other people. That means I think sometimes physicians get into robot mode and put on the mask and then keep the mask on all the time. And that's not healthy. I think if we're sharing what we're feeling with other people, then we're sort of letting some of that go. And by doing that, hopefully it eases the burden of what we do every day. Again, treatment works. It's super effective. There are many people who are willing to do the work. You just have to find them. And hopefully, no matter what level you're at, you have somebody. And at the worst case, call your insurance company. They can set you up with resources nearby that would be covered. Fortunately, our insurance company covers mental health treatment for 100%. So our organization has made sure that there are no barriers for our employees in getting treatment. And so hopefully that's across the board. We're getting there, slow but steady.
All right. So I'd like to thank each of you for your time and for these really important takeaways. If you have any feedback or episode ideas, please email poma@poma.org, and be sure to subscribe to the POMA Does podcast series on your favorite podcast platform or on POMA's YouTube channel. And we will see you next time.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube, or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.